This video is going to be on extravascular hemolysis. Extravascular hemolysis is when macrophages, usually in the spleen, phagocytize red blood cells, break them down to amino acids, bilirubin and iron, and then the bilirubin gets excreted back into the blood, the liver, and eventually into the intestine and feces. Now, low normal levels of this happen on a daily basis, and that's called physiologic hemolysis, but this process can be disrupted. So you can have instances where there's increased phagocytosis of red blood cells by macrophages. So there's more breakdown of red blood cells, more production of bilirubin waste, and that bilirubin goes back into the blood. Most of it's excreted by the liver, but if the liver gets overwhelmed, then it can build up in blood, and it can cause a yellow discoloration of the blood or the plasma, and that's called icterus. This bilirubin can also leak into the tissues and cause icteric discoloration of the tissues as well. Now, the kidney is the overflow organ, so if there's a lot of bilirubin in blood, then it will excrete more bilirubin, so you can have golden or icteric urine as well, and this is called bilirubinuria. But I should note that dogs do normally have a small amount of bilirubin in their urine, so just because you have positive bilirubin on a urine dipstick from a dog, that doesn't necessarily mean that there's hemolysis. Okay, so that's a complete phagocytosis of red blood cells by macrophages. However, the macrophages can partially phagocytize red blood cells as well. And when it does that, it only eats the membrane of the red blood cell, not the cytoplasm. And in doing so, it causes a shape change from a biconcave disc to a round spherocyte. Spherocytes are again round, and they appear smaller in diameter than the normal red blood cell, but they are not actually smaller in volume. So that's important because if you see a lot of spherocytes, or if a lot of spherocytes are present in blood, that will not decrease the MCV. Okay? The MCV is going to be normal, or in cases of hemolysis, it might be increased because of all of the reticulocytes that are present. Okay, these cells also lack central pallor, and they tend to have more red to their cytoplasm. So now I'm going to draw a picture of a normal red blood cell and a spherocyte as you would see them on a blood smear. So this would be called the top-down appearance. The normal red blood cell is a biconcave disc, so it has more red along the periphery and the central pallor in the middle where it's thinner. But the spherocyte is completely eosinophilic all the way across, no central pallor. It appears smaller, it's not actually smaller. And if you were to take a cross-section of the red blood cells and then flip them 90 degrees, you would see that the normal red cell has a biconcave disc, but the spherocyte is still the same. It's spherical no matter what angle you look at it. Now with extravascular hemolysis, there is decreased oxygen delivery to the tissue, so there's tissue hypoxia, and that tells the kidney to increase erythropoietin production, and that results in erythroid hyperplasia in the bone marrow. So you would expect to see a reticulocytosis within 2 to 3 days of the onset of the hemolytic event. So that's it. Extravascular hemolysis causes icterus of the plasma, tissues, and urine. And if there's partial phagocytosis of red blood cells, it can result in spherocyte formation.